What happens at Grandma's stays at Grandma's is a model for you and your grandkids. If it's fun, it's fair game. But lately, hip pain has you grimacing more than laughing. And that's a moment you realize life's too short to put off treatment any longer.
The Joint and Spine Center is Cincinnati's leading destination for orthopedic care, with hundreds of joint replacements each year. So when a moment has the power to change the rest of your life, go to the one place with the power to change it for the better. The Christ Hospital Health Network. This changes everything.
The Pound This podcast is brought to you by Sway, artfully crafted, ready-to-drink cocktails from Mad Tree Brewing. This is episode 774, The Power of Mindfulness with Dr. Gail Gazelle.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This podcast with Amanda Valentine.
Before I get into this absolutely amazing conversation with Dr. Gail Gazelle about mindfulness, I want to tell you about my friend Sarah and Team Fit With Me. If you're looking for a fantastic health coach, maybe you're confused about nutrition, you want to know more about macros, calories, what should I eat, all of that sort of stuff, and whether it's just learning or you wanted to implement it to reach your goals, Sarah and her entire team can help you do that with amazing recipes, lots and lots of recipes. Sarah has a whole bank of those going on that can help you with meal planning if you want. Jeanette's on her team, who's a mindfulness coach or a mindset coach, and she is absolutely amazing as well. So whether you're looking to lose weight or you're looking to manage autoimmune or hormonal disorders, or you're looking to get stronger, Sarah and Team Fit With Me can help you out. And right now you can save 10% off of month one of all packages and plans when you go to teamfitwithme.com/poundthis. And speaking of Sarah, she's actually going to be flying into Cincinnati from Phoenix in August for my Pound This party, which is an all-day wellness event. We're going to have multiple live podcasts featuring Sarah. She's going to come talk about nutrition. Lindsay Bonadonna, who is going to talk about mental health and also mindfulness and affirmations, all that fun stuff. Rochelle Frabota, who has been on this podcast before, will be talking about sexual health. And plus, we're going to have a ton of fun. It is also my birthday party. So no matter what level of health and fitness or wherever you're at, if you just want to know more, you want to learn a lot, you want to have a lot of fun, and you want to have some really fantastic food, I hope that you come to my Pound This party at Mad Tree Brewing in Cincinnati, Saturday, August 6th. Your ticket includes an $88 pair of leggings for free from Me Active. You're also going to get lunch. You're going to get snacks. You're going to get 2 Sways, which was Mad Tree's new vodka soda. So we're going to have some drinks, and we're going to have some amazing birthday snacks. There's going to be surprises. It's going to be fantastic. And you can find the link for your tickets to that along with Team Fit With Me in the show notes. Thank you so much for listening to the Pound This podcast. I am Amanda Valentine. I am very excited to get into this conversation about mindfulness with Dr. Gail Gazelle. Dr. Gail Gazelle is an assistant professor of medicine at Harvard Medical School, which is pretty amazing. So I would say, Dr. Gazelle, you know your stuff when it comes to mindfulness.
Yes, and more importantly, I did a 2-year training, a mindfulness education certification program with 2 really wonderful educators, Jack Cornfield and Tara Brock. And I've had my own mindfulness practice. So yes, I work currently as an executive coach. I coach physicians and physician leaders and others in healthcare. And we do a lot of work on mindfulness and how it can help them really become their best self, be more steady in the world, be more calm, and really improve the way they relate to others, both at work and at home.
So how did you get into this line of work? I mean, I imagine, I know I talk to a lot of healthcare providers specifically, and I know that is an incredibly stressful job, especially the past couple of years dealing with COVID. So did you work in healthcare and realize, wow, mindfulness really needs to play a role here? Or how did you get to where you are today?
For most of my career, I was a physician in hospice. So my main interest was helping individuals who were really, facing the end of their lives and helping their loved ones as well. And I really saw how mindfulness could help people. Obviously, couldn't cure whatever disease that they had, but could help them cope and manage with not just the symptoms they were having, but with the existential and psychological experience that they were going through as they faced coming to the end of their existence. So I could really see how mindfulness played a role. About a decade ago, I moved from being a hospice physician and actually became an executive coach for other physicians and physician leaders. And there, the role of mindfulness really cannot be underestimated. We learn very little in medical training, and I think this is true for nursing training, and it's true for many others. We just don't learn a lot about how to manage our own mind, how to work with all the thoughts that come up, all the emotions that we experience on a given day, all the challenges that we have, all the fears and anxieties and worries. We don't learn how to work with this one instrument that we all operate 24/7, right? Our mind. And that's really the beauty of mindfulness. It's a form of mental training. It's a form of helping us really learn how to use our mind in a much more effective way. So it's helped me personally, and I've seen it help just thousands of others. And that's really why I'm so committed to spreading the word and helping people access all that mindfulness has to offer.
So I think that we need to kind of like pick apart what mindfulness is, because I think that's become like such a just a buzzword, a general term where we hear mindfulness and we're like, what does that mean? Does that mean I'm meditating? I need to zone out? Like, so it just kind of feels like, oh yeah, I need to be more mindful. And it's like that thing that you say and then you just kind of throw away and you don't really do anything with it other than like, I don't have time to zen out right now. I have places to be. And again, stay in that like hyper, super stressed out, keep on going, keep on hustling attitude. So what is mindfulness and how do we actually get ourselves to a place of practicing it?
Well, all that you're saying makes so much sense. Our lives are just so incredibly busy in Western society. Go, 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 achieve, 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 get to the next thing, right? We're always kind of in that state of movement and moving forward. And, on a technical level, a definition of mindfulness is it's a type of awareness that comes when we pay attention to what's going on in the present moment, the moment that's occurring right now. And we do so with less judgment and more compassion than most of us bring to the moments of our lives. So if we unpack that, well, what is the present moment? The present moment is what's here right now. Our minds spend a lot of time drifting to the past, replaying arguments, kind of thinking about things that have already happened, or gravitating to the future. Well, that vacation that I'm going to have, and what am I going to eat for lunch, and what's going to happen when my kids get home, right? Our mind is almost constantly flitting about here, there, and everywhere. And the beauty of mindfulness is, again, in a very pragmatic way, it's about training our mind to stay where we want it to. It's about kind of honing our ability to focus on what's actually going on right now, as I'm talking to you, Amanda. But my mind and your mind could be drifting somewhere else. So we're training our mind to actually focus where we want it to focus. And the gift of that is that in that quality of presence, we can actually relate much more skillfully to whatever difficulty we're facing, right? We can really apply ourselves with the clarity that that awareness gives us and be most resourceful in coping with anything, whether it's fears around the pandemic, whether it's difficult bosses that we have, whether it's teenagers who aren't doing what we want them to do, whether it's how we relate to our own inner critic. All of those ways we really learn with mindfulness to be very intentional, to be very resourceful, and really to have the skills we need to move forward productively in this one precious life that we get to lead.
So do you have any recommendations of how do we actually stay in this moment without drifting? I know for me personally, a practice I've been trying to work on for a while, speaking of like physical fitness, is that when I'm working out, I want to tune my brain out. So I won't focus on like the mind-body connection. Like I won't feel things. It's like just crush through this instead of actually focusing on what I need to. And I realize I do that so much. So I'm trying to be mindful of doing that, of like, no, actually sit here and feel this and breathe through this, and at least in that specific practice, because I know my brain is all over the place all of the time, but at least in that instance where I'm like, I'm lifting heavy things that could potentially injure me, I really need to be focused in this moment. I try to do that, or just even like tapping the muscle that I want to focus on and trying to bring myself here. Like, this is what I'm thinking of, tap, 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 and trying to do that for in my own way. I mean, am I even doing that correctly? Is that one of the tips you would have? Because I feel like it's so hard to pull yourself right here, right now. Even in this interview, I'm still thinking, what's my next question going to be versus fully listening to what you're saying. It's so hard to stay here.
isn't it? Yeah, we just don't learn how to stay present. And you're bringing up so many good points, Amanda. The one that I really like is that how can we stay in the body as a counterbalance to staying in the overly busy mind? And that's something that most of us don't learn to do. And so whether we're lifting heavy weights or whether we're in an important conversation with our partner or with a coworker or a patient or whoever it might be, wouldn't it be wonderful if we could step out of all that busyness and actually just focus on what's in front of us? So, when you ask about tips, you're saying something so important. The breath, which is typically our anchor in meditation, helps us come back to the body, right? The mind may be flitting about, but we can count on the body to be present here in the moment that we're in, right? That's the anchor that we have. And so, with mindfulness, we kind of pay attention to our breath. We can do that through the practice of meditation. That's a way to build our muscle of mindfulness. But we can also just kind of try to slow things down, whatever's going on within us. And using our breath can help us do that, can help create a little bit of space between the busy mind and the moment that we're in. It's a little bit of a bridge to bring us and keep us in the present moment where things are usually nowhere near as bad as our silly little mind is telling us, right? When you think about COVID and you think about all the fears that most of us have had over the last 2 years, fears about personal safety, fears about our loved one, fears about our job, fears about finance, fears about all the uncertainty and what's going to happen next. If we can actually take that little bit of a pause and come back to our breathing, we can help free the mind from kind of the servitude of all of those fears that we get caught up in that don't help us, that just keep us in a survival state, keep us clenched and tight, right? And unable to really be with whatever human being is in need or really to be there with ourselves. So it's quite powerful what we can do just by harnessing the breath, which thank goodness is always present.
Yeah. And I don't know if you know the answer to this, but why do you think it is just so scary for us? Like, why is the brain so adverse to staying in the actual moment? It feels like that's almost way more uncomfortable to stay present in the current moment than to go through all of these, doomsday scenarios in our brain. So it's like, why are you like that, brain? Why is this moment so bad that we have to constantly avoid it?
Well, I think what many experts would say is that it relates to the way our brain evolved. I mean, obviously, having a human brain is a wonderful thing and gives us so many skills. And yet, part of the ways that the human brain developed was to protect us on an evolutionary basis. We did not rise up the evolutionary ladder because of physical prowess, right? We don't have, the strength of a tiger or a woolly mammoth or all those creatures that, kind of were out to kill us back in caveman and cavewomen time. And so our brain developed this ability to scan the environment for threats. That's how we survived, and that's how we rose up the evolutionary ladder. But now that we're not in the same kind of physical threat that we were back in caveman and woman times, what are our brains tuned to? Well, they're very attuned, finely attuned to psychological threats. So psychological threats come in a lot of forms. They can come in the form of a text, a two-word text, no, or something. And all of a sudden, our emotional temperature rises and we think that the person hates us or they're not hearing us or whatever it is, right? That's the kind of psychological threat. Somebody honks their horn behind us and we're waiting for an elderly person to cross the road. And all of a sudden, again, we feel smoking mad. That's a psychological threat. So our brains are so attuned to that. And because our brains have developed the ability to have thoughts, we rely overly on those thoughts. I don't know that we fully understand the neuroscience of your specific question. Why do we give in to kind of all the silliness that our brain is up to? But we don't learn to do anything differently. We learn to think. Right? That's what we see modeled. We don't see modeled relying on the breath or coming back to the body or really leaning into all the wonderful information that our emotions can provide us and our physical senses can provide us. So we're kind of unbalanced, brain, body not so much. And it leaves us with a lot of distortions, a lot of lack of clear seeing what's actually in front of us, a lot of assumptions and beliefs that can really get us in trouble.
So I think it's easy to say like, okay, well, we're going to focus on mindfulness and it will calm us down and take us out of a stress response and we can deal with those things better. But I think that there's so many other levels of what mindfulness can do for you. And I think that for myself included, like a type A personality where it's like, okay, well, being calmer sounds good, but how is this going to help me end up being more productive? How is this going to make my life better? And I'm sure you kind of hear that response from physicians all the time who are definitely type A of like, okay, cool. Yeah. Being Zen, but how is this like going to real world scenario benefit my life by being more mindful?
Isn't it funny how that can be counterintuitive
Right.
to us? And yet, when we can actually calm ourselves down, it's amazing how much more we can focus and how much more productive we can be. So, a lot of physicians and nurses are struggling in healthcare around one particular thing, which is the electronic health record. I don't know if your listeners are familiar with this, but over the past decade, healthcare has become very technologized, of course, and all of our documentation of what happens when a patient comes into a hospital or an outpatient visit or has surgery has to be typed electronically into the medical record. Well, the joke on the street in healthcare is, guess how many clicks it takes to order an aspirin? Well, it takes 4,000 clicks. And that's an exaggeration, but it's kind of crazy now that we have this electronic medical record. Doctors and nurses have to spend hours of their day actually documenting a patient visit, a crazy amount of time. It's been estimated 2 times as much time on the medical record than actually dealing with the human being who's struggling and who has come to see you for care. So, this whole issue of efficiency is front and center in healthcare. How can I be efficient at getting my notes done and also take care of the patients who I need to take care of as a doctor or a nurse? So, how does mindfulness help? Well, doctors that I work with sit down to chart, to document into the electronic health record, and they're besieged with thoughts. Oh, why do I have to spend my time doing this? I hate the electronic health record. Why can't they just let me see my patients? Why should I have to do all of these menial tasks when I'm a doctor and I have all this knowledge? So their mind just kind of goes and they can't actually focus on the task of getting the charts done. Their mind even further goes to, oh, maybe other doctors are smarter than me. Maybe they're better at this. What if I'm an imposter? Like the mind just kind of goes, goes, goes. And then they have trouble actually getting the charts done. So that's one very practical example. If we can harness the focus of the mind to get whatever task it is done, particularly tasks that are odious, that are difficult for us, it's amazing how much more efficient we can be in the course of our days. I've seen that in myself, and I've seen it with hundreds of physicians that I've coached. So this idea that somehow being Zen is going to make us passive and we're not going to get anything done, I think it's actually the opposite of that. It's about training the mind to focus where we want it to focus.
Yeah, and I will say from my own personal experience, and I'm sure that you will agree, of just how much this has to be taken in as a constant practice, because I know, at least especially for me, of having such a weight loss journey and talking about health and fitness, and everybody wants those results like tomorrow. Like, can I lose 100 pounds in 2 months? And I want these results right now, and I want to be more Zen, and I want to be more productive, and I did the breathing exercise 3 times this week, and how come I'm not more calm? Of like, it's just, and I fall right into that category too, and guilty, but it's like one of those things I think that like you catch yourself more and more doing it. And a real world example for me is, again, those breathing exercises, which aren't my favorite thing to do. And it's like, because I have such a hard time slowing down. But I had a scenario where I couldn't find my keys in my bag, and I could just feel the blood pressure rising, and I'm getting frustrated. And I literally am like, just stop and breathe. And I did a series of like straw breaths where I'm like, and then I put my hand right back in my bag and pulled the keys right out. And I'm like, oh my God, it worked. And so it's after like, just trying to just the grind of like practice, but like stop and catching yourself in those moments and stopping yourself. But it is like takes so long. And I think so many people give up before you get to that place where you're actually starting to kind of see real world results, because you're not like retraining your mind doesn't take a week.
Well, that's a great example, Amanda, with the keys. You know what's another example? I coach a lot of women who have young kids, And here's just one example of a physician that I was coaching recently, lovely woman in her early 40s with a 5-year-old child. And, beautiful young child, very well adjusted, but, can be difficult at times, like any 5-year-old. And so the mom who I was coaching was telling me about how guilty she feels because it's not infrequent that she kind of explodes. She tries to be patient, she tries to be present with her 5-year-old, but invariably the 5-year-old kind of stalls. Let's say he's cleaning up his room, or he's supposed to get dressed, or he's supposed to get in the car. You know how 5-year-olds are, they stall. And she would just lose it and explode. And she felt terrible about herself. And she had learned that behavior from her parents. She'd had a parent who did something very similar, not uncommon. We learn things from our own parents. We swear to ourselves, oh, I'm going to be different. And then we find ourselves doing the exact same thing. Well, with mindfulness, she was able to slow herself down in those moments with her child, in those moments where, like you said with the keys, her emotional temperature was rising. We worked on a protocol where she would take her emotional temperature, she would rate it on a 0 to 10 scale. And that was really helpful because that was almost an early warning sign that she was about to lose it with her son. So she would take her emotional temperature. When it was up, she would pause and take those 3 slow, deep breaths. You can do straw breathing, you can do square breathing, you can do 4, 7, 8. There's a zillion types of breathing. The key thing is just to pay attention to your breathing, just to help you slow things down, to help you decrease that kind of sympathetic drive that's really pushing your emotional temperature. And when she did that, she automatically had more patience with her child. She automatically could be the kind of mother that she so wanted to be. She almost automatically could let go of all that sense of regret that she felt every time that she exploded with her son. So the payoff just for her was intense. Of course, the payoff for that innocent little 5-year-old who, all of a sudden his mummy would explode, like how that left him feeling. So I think what's in it for all of us to be more mindful, to practice these techniques, really, we can't underestimate what's in it for each of us in our relationships, in the quality of our days. It's powerful.
Definitely. And so would you say that pretty much, I guess, mindfulness starts with just being self-aware?
It is all about self-awareness. When we pay attention to what's going on in the present moment, it's amazing what we see. All the patterns of reactivity that we have within ourselves and with others. We often don't even realize it. Many times we don't even realize just how busy our mind is. So that's the other benefit of mindfulness. Like we can't really intervene with our mind until we know what it's up to. So that's the gift that mindfulness brings us.
So would you say a good way to start is to maybe like carve out some time in the day of like, okay, I'm going to take the first 5 minutes of the day when I'm drinking my coffee or taking a shower, or I'm washing the dishes, or just taking some sort of like moment to tune in, so you can kind of like, not to say like you're like it's scheduled mindfulness, but is there a way to just kind of make sure that at least you start the beginning of the training somewhere?
Well, another term for scheduled mindfulness is meditation. And so meditation is the best way to develop mindfulness, to get to know what the mind is up to. And we can start small. We can start with 3 minutes or 5 minutes in the morning. There's so many apps out there now. I have a free 14-day meditation series on my site, called The Daily Dose of Calm, which people can download, where I give some teaching about a topic in mindfulness, and then I guide a meditation. So meditation is the best way to develop the muscle of mindfulness. But as you've noted, it doesn't happen with one meditation or 3. That's why it's called a practice, because just think about all the hours and years that our mind has been in the practice of thinking, overthinking. So as we meditate and we're trying to focus more on what's here right now and kind of step out of the busy, busy mind, that takes a lot of practice because we're retraining the mind in something that it's unaccustomed to doing. But we can do that with meditation. We can also do it by just paying attention to our emotional temperature, just like you did with the keys. You noticed your emotional temperature was off the charts and it wasn't helping you. You were fishing around in that bag and you just couldn't find the keys. And yet when you lowered your emotional temperature, just with some simple breathing, 20 seconds of breathing, all of a sudden you found the keys. And that's what we're doing, just slowing things down a little bit, helping to cool down kind of the emotional state that we can all find ourselves in.
Yeah, I mean, I find it incredibly helpful. And I know that the days where I would meditate, I did feel like immensely better, but then I wouldn't make it a priority. So it's like one of those things that kind of like everything else, like, oh, I know whenever I work out, I feel better, but then you just don't do it for 3 months. So it's like I knew it was better. And so actually, like currently, right now, I'm on day 15 where I'm like, I've made myself a challenge of like, you're going to meditate for at least 10 minutes a day. You can't miss a day, because I want to ingrain it into a daily habit, because I know how important it is to me and how it changes the temperature of things for me and how I can be more mindful and take negative scenarios and how much easily I can switch it into a state of gratitude of like, what is this teaching me instead of why is this happening to me sort of attitude. So for me, I think that giving myself my own little challenge of just do this every day and try to ingrain it into a habit, because I know it's healthy, at least helps me personally. I don't know if you would recommend that or not, but it kind of gives me some lanes and some parameters of like, not every day am I going to reach a Zen-like state and tears are streaming down my face because I have like unlocked the keys to my brain, but I'm just taking the at least 10 minutes a day, which I have, to just try to calm myself, and it makes it a massive difference.
Well, like you're saying, developing a new habit, takes effort. And one thing I would recommend is not getting into the, oh, I should meditate, because once we start doing that to ourselves, it's hard, actually. It's not motivating. Sometimes
Okay.
it's actually the opposite. But to really focus on, well, what's in it for me? What's in it for what's important to me, my state of mind, my peace of mind, my contentment, my relationships with my children, with my work, coworkers, my quality of life. I want to encourage your listeners to think about that. And like you said, doing it in the morning. I know for myself, I used to try to meditate at the end of my workday, and it never happened. You're exhausted by the end of the workday. You've got dinner to prepare, you've got family members. So I recommend really making it a pattern in the morning. And like you said, doing it over your cup of coffee, something that's already part and parcel of your day. Because we have so many distractions in modern society, right? Just our devices alone, we can, spend hours going down those rabbit holes. So we want to make it a structure that is doable, and linking that, like James Clear teaches us in Atomic Habits, for example, linking it with something that we're already doing every morning can really be a powerful assistance.
Definitely. So if somebody wanted to get started and start with your guided meditations, where do they find everything that you do?
My site is gailgazelle.com, GailGazelle.com, and I have a whole section of free resources. I also have a book coming out this year. I had a book come out in 2020, Everyday Resilience, a practical guide to build inner strength and weather life's challenges. And I'm really excited. I have a new book coming out late this year, Mindful MD, How Mindfulness Can Cure Healthcare Burnout and Restore Hope and Autonomy for All.
That's
So
awesome.
that'll be another resource available to people.
Great. Well, Dr. Gail Gazelle, thank you so much for your time. This was incredibly helpful.
Wow, a pleasure. Thanks so much for having me on the show.
AmandaValentineBites.com